Bismillah ar-Rahman ar-Rahim. Today lecture about the female reproductive system pathology. Before enter to pathological change of female genital system, we start with a short topic of anatomical structure of this system. The female genital system consists from two ovaries with fallopian tube, pairs of fallopian tube connected to the body of uterus. Uterus, a hollow organ, as we know, consists from 3 layers of wall: endometrium, myometrium, the major part, it is muscularis part, and perimetrium, as serosa in the other part of the body. And the last part was the vagina. This is a shotgun review of anatomical structure of female genital system. In pathological lesion, we will begin talk. Consequently, we will start from the ovary, then we will talk about fallopian, pathological change, fusion fallopian tubule, and then we will talk about the uterus, and at last we will take the accessory, sexy gland, and the major important one in the female reproductive was the mammary gland. The pathology of female reproductive system, as we say, we will start from the ovary. The most common pathological lesion occur within ovary, which is ovarian cyst. And there is much more than one type of ovarian cyst affect the ovary, such as mucinous cystadenoma, endometrioid ovarian cyst, hemorrhagic ovarian cyst, dermoid ovarian cyst, and others types of cysts maybe occur within the ovary. But there is two types of cyst, which is functional cyst, and these two types are follicular cyst and corpus luteal cyst. These types of cyst, the most important types, which can interfere with the function of the ovary. The first one, follicular cyst. The follicular cyst develop following the failure of mature follicle to ovulate. As we know, the ova develop inside the follicular cyst, and when reach to the mature state, the follicle will be ruptured and the ova will be released and ovulation occur. Sometimes this part of maturation, the part of ovulation fail, and the follicle persist, and due to fail of ovulation and follicular cyst develop. The other type of functional cyst. We mean by functional cyst, this cyst can produce hormone, interfere with the estrous cycle, interfere with the fertility of the genital system, fertility of male. The follicle cyst usually produce an elevated estrogen level, and luteal cyst usually functional cause increased progesterone level. Where in the normal physiology, when follicle ovulation occur, the remaining tissue develop to produce corpus lutea, and the corpus lutea dissolve within time. In some time, the ovulation fail, as we say in follicle cyst develop. When the ovulation fail, will produce follicle cyst, and this follicle cyst proceed in maturation and produce luteinization or luteal cyst or corpus lutea cyst. This corpus lutea cyst characterized by a thick wall opposite to the structure of the follicle. Follicle contain thin wall of cyst, but the corpus lutea composed of thick wall. This thick wall composed from a granulosa cell. This granulosa cell produces progesterone, so it is functional cyst. Its effect in fertility. The other types of cyst, and which is very common within cow, called cystic ovarian disease. The cystic ovarian disease, as we see in the picture, the ovary contain from the many follicle. This follicle, cystic follicle. This follicle usually cause infertility. The ovary cannot produce more ova and cannot ovulate because the surface of ovary filled with follicle cyst, persistent, not permanent, temporary. Sorry, not temporary, but permanent cyst. This disease occurs mainly in cow and it's called cystic ovarian disease. It's important in cow, and cow develop signs of hyperestrogenism and cystic endometrial hyperplasia and infertility. Other diagram to cystic or within human called polycystic ovary. As we see in diagram or in figure, there is many cysts near to cortex of ovary. This cyst prevent any new cyst develop from central layer or the medulla of ovary to produce of new ova within cortex. Also, we have condition called persistence of corpus lutea. The persistence of corpus lutea differ from corpus lutea cyst. Corpus lutea cyst fail of ovulation. Follicular cyst produce, and the follicular cyst will continuous proceed to form corpus lutea cyst. So we can say the corpus lutea cyst, which is a follicle cyst, developed to become corpus lutea cyst, but the persistence corpus luteum, which is mean retention of corpus luteum. This retention of corpus or resistance of corpus luteum and corpus luteum become a permanent luteinized cyst. Usually it should be dissolved after maturation and disappear from ovary. In the case of persistence of corpus luteum, it's become a persist and become functional progesterone secretion, and it is usually occur in cow. This case, the Pyometra may be developed, hyperplasia with the endometrial gland also occur. The ovarian neoplasia, most common type, which is ovarian adenoma. The primary ovarian neoplasia originated from any type of tissue within ovary. The ovarian neoplasia, based now with cow and mare bitch, and it is usually occur in all species. This tumor mostly occur in dog. This tumor in malignant state cause obstruction to the lymphatic vessel and lead to ascites developed within animal. The other common type of tumor, Dysgerminoma tumor. Not important type. Let's move to the important type. Important type called granulosa cell tumor. Granulosa cell tumor, as we know, the granulosa cell, this cell forms the wall of corpus luteum, or luteinized tissue, The granulosa cell, as we know, it's produce testosterone. This cell tumor occur mainly within horse and is mostly benign, but it is really large, and this size interfere with the other body organ. So the surgical remove, which is the best curative way. The last type of neoplasia occur within ovary. We discuss it in some details with chapter of neoplasia, which is teratoma. Teratoma originated from germ cell layer of ovary. When there is a single germ cell, may be mitotic and become deviation and develop this type of tumor. And as we say before, 90% of teratoma within ovary, which is benign, and it is rarely become a malignant. We can distinguish this type of a tumor by characteristic shape of it. It consists from teeth, bone, from adipose tissue, also from hair follicle, and maybe the cyst formed, and as we say, dermoid cyst. We called it dermoid cyst filled with the sebum from sebaceous gland within the skin. An inflammation of ovary called oophorytis, and also called ovaritis, both of them, which is correct. The inflammation of the ovary usually bacterial, and in 19% of oophorytis, the causative agent come from systemic bacterial infection, as in this picture. we see the granule formation within ovary. It's look like a TB infection because when see the part of intestine also include this lesion, also heart include this lesion. Maybe it's miliary TB. Let's move now to the second part of the female genital system, which is the fallopian tube. Fallopian tube. This tube-like structure help in transfer the ova from the ovary to the uterus when it's become a plant, and in this pathway and this passage the ova fertilized with an oviduct, as we know in physiology. The fallopian tube have a common pathological lesion and include hydrosalpinx, which means there's the accumulation of a fluid within the lumen of this tube. Also, there is accumulation of pus called biosalpinx with a blood, hemosalpinx, and the inflammation of salpinx called salpingitis. And salpingitis occur a continuity to infection of the uterus. Usually it occurs as this type of inflammation. The major problem occur within fallopian tubule, which is obstruction of a fallopian tube. The obstruction is due to inflammation and chronic irritation to the epithelia, maybe due to hyperplasia, mechanical pressure from the outside, also due to accumulation, as we say, accumulation of a fluid, accumulation of a blood, accumulation of a pus. All this causes infertility. How it become infertility? Because the ova cannot passage through the salpinx and reach to the uterus, and infertility occur. Now we move to the, as we say, the hydrosalpinx collect of fluid, and this collection causes obstruction to fallopian tubule, and this is a big problem. The third part, we take the first part, which is the ovary, second part, which is the fallopian tube. We now reach to the third part of the female genital system, which is the important part. It is the uterus. The uterus, anatomically, a muscularis organ contained from 3 layers, as we mentioned before, from the endometrium, myometrium, and perimetrium. Usually the lesion involved both endometrium and myometrium. Before we enter to a specific lesion, generally we have miscellaneous condition occur usually and commonly in the pregnant uterus. The pregnant uterus may be suffer from torsion. The torsion lead to circulatory obstruction and fatal death. Also, the uterus could be ruptured from the wall of uterus, and this is a serious condition which may lead to death of both. The rupture of uterus lead to bleeding to internal abdominal cavity and cause severe inflammation. The common condition occur within cow. It is very common condition. It's called prolapse. The prolapse, which is mean the uterus throughout from the vulva, and it is occur after paturation in cow. The treatment is very simple. You just clean the uterus and wash it with water and soap. Treat it with some antibiotic and return it to its normal location, and then suture the surface to prevent it from a prolapse again. Let's move now to the more specific condition. The more specific condition include disturbance in the growth of endometrium. In the endometrium, we have two types of disturbance of growth. We have atrophy of endometrium, and we have hyperplasia of endometrium. This opposite suffix due to different functional causative agent. The endometrial atrophy occur due to cachexia or due to ovarectomy. The ovarectomy, which is mean surgical remove of ovary. The surgical remove of ovary will be lead to hormonal disturbance, and there is no ovarian hormone secretion, so the endometrial gland become atrophy, because the signal that make endometrial gland growth and hyperplastic, which is hormonal signal from the hormonal ovary. The endometrial hyperplasia, and before we talk about the endometrial hyperplasia, the endometrial atrophy on histological level, as we see in the lecture, the absence of the gland from the endometrium. In the right picture, the atrophy clear within endometrium site. In the left picture, this structure, which is normally founded within endometrium. The endometrial characterized by gland formation. This gland formation, all types, cystic type, hyperplastic type, normal type, premature type, all these type disappear within atrophied uterus. The endometrial hyperplasia, it is mean the increase in the size, increase in the number of endometrial. As we see here, there is an increase in the size of cell and an increase in the number of cell. Increase in the number, increase in the size. The increase of this number and size, and maybe it's combined with dilation, cystic dilation, which is called cystic endometrial hyperplasia. This is commonly occur in bitch and equine, also it's occur in cow. It's mainly due to estrogen alleviation, due to estrogenic plant eaten by animal, or estrogen therapy. Also tumor within ovary also cause increased secretion of progesterone, and as a consequence as a response to this increase of hormone, the endometrial will be hyperplastic. The inflammation of uterus, the myometrium of uterus called metritis, endometrium of endometritis, and it is usually a combined both of them, metritis and endometritis, and it is usually occurred due to bacteria infection. In normal physiological state, the uterus resistance to bacterial infection, and there is a huge immune system activity within this area. It includes humoral and cellular immunity. But during the luteal phase or due to stress cycle, in some point of stress cycle, the uterus become more widening within cervix and become open, and that will allow bacterial and other microbial agent enter to uterus and use it to proliferate and affect it, cause metritis and endometritis, and this metritis endometritis may be acute, also chronic, maybe combined with pus production. In this case, we will call it a Pyometra. Pyometra, which is mean accumulation of pus with a uterine lumen. Disease of, as we see in this picture, the Pyometra, which is, as we say, accumulation of pus within uterus. The healthy uterus and its size, and compared with the uterus with Pyometra, as we see the increased lumen diameter. Disease of pregnant or Gravid uterus. As we know in physiology, when we want a success pregnancy, should the healthy uterus and correct hormonal level, both of them should be founded to success the pregnant and parturition. If any disturbance with the hormonal or any problem with uterus healthy, the pregnant fail and parturition fail. Maybe fail at the implantation of ova, maybe abortion occur, premature birth occur, maybe this problem cause prolonged gestation period. The embryo, which is maybe die within first week, go to absorbed. Meanwhile, the death of fetus when it's become mature or become more advanced stage may become mummified. Mummified turn to this shape, like mummy of Egyptian people. The mummification occur when there is no bacteria within uterus body, but if there is any bacteria, the mummification not developed. In August, the maceration and lysis putrefaction to the fetus will develop due to bacterial, opportunistic bacterial or bacterial uterus occur. Maceration, as we see in this picture, lysis of all body part of the fetus after its death. Last and not least, In the female genital system, before we start talk about the mammary gland, we have developmental abnormalities in the female reproductive system. These developmental anomalies rarely occur and uncommon in the animals, like the unicornate. The uterus have unicorn or non-fuse corn or fuse corn but not connect to the cavity, and other abnormalities not important in vet medicine. In veterinary medicine we have anomalies much common and much important, and it is the freemartinism. Freemartinism, which is mean a female born co-twin with male. When the cow becomes pregnant, the twin of this cow, one of them female and the other which is male, and when these two twins share the same placenta, it's called anastomosis placenta. The hormonal produced by the male will travel through the placenta to the female, and this causes the female look like a male with inconada and become infertile female. Freemartinism very common with bovine. About 2% of pregnancies come with freemartinism. The mammary gland have a common congenital anomalies, which is supernumerary of teeth. As we know, the animal have 4 teeth in cow, but there is 2 extra teeth. This is a congenital anomaly called supernumerary teeth. The most important in pathological lesion of mammary gland, which is mastitis. This condition is very important in medicine of veterinary medical school, because as we know, the economic importance of cow include milk production. When mastitis occur, the milk production will be declined or become improper milk for consumer. The mastitis generally occur due to bacteria invasion of the mammary gland, and usually occur from the external route from the teat canal, opposite to uterus. In uterus and ovary, we see the infection usually come from hematogenous, from systemic infection. In mastitis, the opposite occur. The infection comes from the outside the body via the teat canal. Also, the hematological root cause like tuberculosis, brucellosis, Also, it causes systemic infection and mastitis within teeth. The bovine mastitis, as we say, major problem in dairy industry. And this characteristic features of inflammation clear occur with another the redness and congested, hyperemic, the characteristic features of chronic inflammation, acute inflammation. Also chronic inflammation occur and gangrene, granulomatous, all these type of inflammation occur within mammary gland. The chronic and granulomatous inflammation usually occur due to Strepto or Staphylococcus, and this type of infection is life-threatening and cause big problem to the production of milk and maybe lead, as in chronic inflammation, lead to fibrosis of the mammary, and this cause loss of the production of milk. And as we know, if there is no teeth, no cow. If there is no teeth, no cow. No milk, the cow become useless and the economic purpose will disappear. The neoplasia, very common within mammary gland, especially within dog and cat. The mammary gland neoplasia usually in cat about 19% are malignant. 18% of dog neoplasia, which is benign. In cat, 19% malignant. In dog, 18% benign. And the most common type of mammary neoplasia, which is adenoma or adenocarcinoma. Also, there is fibroadenomatous hyperplasia occur, usually in cat. And when the cat become older, old age, cat suffer from this condition. The lobular hyperplasia common, and the metastasis to the inguinal or axillary lymph node is much common metastasis type or behavior to the mammary tumor. Before we end our lecture today, we will take some important term in the disorder of female reproductive system. This term you should be saved it to your memory because you will be use it in the surgery and medicine at the next stage. Infertility. Infertility means involuntary reduction. Sterility, total inability. Infertility may be treated. The sterility cannot be treated. Nymphomania, which is mean excessive sexual desire, and it is usually due to increased hormonal concentration. Hermaphrodite condition, when the individual has both sex tissue. Pseudohermaphrodite, which is mean the individual have the gonad of one type of sex and the genitalia of the opposite. As we say, male with penis but has ovary. Pseudopregnancy, physiological change in menstrual female stimulated pregnancy. The cyst, there is many types of cyst: dermoid, hemorrhagic, mucoid, and the important two types, follicle and luteinized cyst. We discussed the oophorytis and salpingitis. Hydrosalpinx also mentioned before. Biosalpinx pus accumulation with fallopian tube, the oviduct, which is the other name of fallopian. Biosalpinx and salpingitis is most common occur within poultry disease. Adenomyosis, the endometrial gland migrate to the muscular layer and proliferate within it. Hydrometra, the name mentioned to hydro, within uterus. Endometritis, we discuss it. Metritis, we discuss it. Pyometra, pus, metra, uterus, pus within uterus. Mucometra, mucus within uterus. Apportion, attention to this suffix, apportion. Apportion means expulsion, non-viable embryo or fetus before time of maturation, before the time of pregnant end. This is called apportion. In the second semester, trimester, it's called apportion. Stillbirth, born of dead. When the pregnant time finished, the maturation occur and the dead born baby happened. A premature birth, a birth of viable fetus before term. Mummification, discuss it before. Placentitis, inflammation of placenta. Hydrogenous accumulation of what? With amnion membrane around the fetus. Hydroallantosis, accumulation water fluid with allantosis of fetus. Dystocia, all of these terms mean difficult in birth. And at last, I hope you understand what we say and what we discuss, and I hope a happy time for you, and thank you for listening.